So this is more of like you trying to look at the meaning meaning of changes in what radioactivity. So if you're having like an increase in radioactivity, or if you're having a decrease in radioactivity, what does it actually mean? Alright. So we're saying that changes in radioactivity are most significant, and that is when they are localized or asymmetrical. All right. So we look at the various what different types of changes in radioactivity that could be observed. So if there's increased activity in the perfusion phase, it's mostly due to what increased soft tissue blood flow, right? So usually suggests that probably there's an inflammation, which could be acute or chronic, right? It could be that there's a fracture, it could be that there's a highly vascular tumor, or there's a regional what sympathetic dystrophy, right? All of this could cause an increase in radioactivity. So if there's decrease in radioactivity in the other way around, it usually signifies that the blood supply is reduced or is insufficient, right? Blood supply is reduced or insufficient, right? One of the causes of a reduced radioactivity. Okay, so increased activity in the delayed bone phase. This will be due to either what an excessive isotope uptake in the osseous extracellular fluid, or it could be due to what a more avid incorporation into newly formed bone tissue, right? So either of these will be likely a fracture, implant loosening, infections, a local tumor, or healing after what necrosis, right? So nothing in the bone scan itself distinguishes between these conditions, right? So if there's diminished activity in the bone phase now, this one we're talking about the perfusion phase, right? So if there's diminished activity in the bone phase, is mostly due to an absent blood supply. Probably there's a femoral head fracture. You trying to observe the femoral head after a fracture of the femoral neck, okay, or replacement of bone by pathological tissue, right? So this is basically changes in radioactivity in the perfusion phase or bone phase, right? What they actually means, okay? So that's it, guys, and bye for now.